Welcome back. As a global leader in digital inclusion initiatives, Scotland has been at the forefront of digital government and service delivery. In this all-Scottish panel discussion, we'll hear about Scotland's ongoing journey building its citizens' digital skills, closing the digital divide, and bringing more care to people across the country. I'm excited to see what we can learn from them as Nova Scotia emerges as a leader in digital inclusion here in Canada. For those of you watching, we also want your input and feedback on today's conversations. In the session description of the forum site, there is a link to a forum you can add your perspectives and reflections on the topic. We should be able to add that link into the chat as well. Now, as most of us know, Nova Scotia means New Scotland. But Scotland is more than just our namesake. We have a lot in common that makes their digital inclusion journey very relevant for us. We share a similar geography and demographics with Scotland. And when COVID-19 kept folks in their homes, Scotland responded with support and training for tens of thousands of people that inspires us to this day. Here to tell us more about the highs and lows of their ongoing journey are four people whose work is making a big impact in Scotland. We're thrilled to have them with us here today. Let's meet them now. Welcome, everybody. It's so great to see you here today. Let's find out who you are. Let's get some introductions out of the way. We'll start with Shona. Shona, can you please introduce yourself? Tell us where you work, what you do, and maybe what you've been working on lately.
Morning, Matt. Thank you for having me and the rest of the team here. It's lovely to be here. And yeah, I am Shona Munro. I work with an organisation called Mhor Collective. Mhor Collective looks specifically at digital inclusion. That's what we're all about. That's what we do. Mhor Collective have been around for 8 years now. Myself and Irene, who's also on the call, set Mhor Collective up 8 years ago, but prior to that, we also worked with separate organisations who also looked at digital inclusion. So we've been doing digital inclusion across Scotland now for 15 years, probably. And yeah, it's all we do and what we feel really passionate about. We sit largely within what Scotland would call the third sector, so non-profit. Although we do work in public, so government organisations and private as well, but most of our work sits within the third sector in Scotland, very much alongside Irene at SCVO and Tara as well. We have lots of different strands on at the moment, which I think we'll get into as we go through the chat. So I won't bog down with all the details at the moment, but we see health as evolving quite rapidly in Scotland right now, digital health, and that's impacting a lot of our work streams, which we'll get into later. But I can pass you on to Irene, my colleague. Is that the best one to pass to right now? We can round off the more collective part of things.
So I'm Irene Mackintosh. I'm another part of our team at Mhor Collective. We are scattered across Scotland. A lot of us work from home. We do a combination of grassroots work right up to strategic work. We usually work with digital champion models. So what we mean by that is trusted faces in trusted places that are able to provide one-to-one support, not a whole learning curriculum around digital, but really meeting people where they're at and giving them the skills and confidence to go forward. And as Shona said, we've been doing this since unbelievably before touchscreen technology existed, and it's really changed. The landscape has really changed over these years. And as Shona said, we've been working with our other colleagues in Scotland extensively since then as well. I'm handing over at you, Aaron.
Thanks, Irene. Hi everyone, my name's Aaron Slater. I'm the Digital Inclusion Manager at an organisation called the Scottish Council for Voluntary Organisations, or SCVO. We are a membership body that supports, promotes and develops Scotland's voluntary sector, not-for-profit sector. My specific role is to look after our digital inclusion team, where we deliver a range of work, primarily looking at building the capacity and capability of voluntary sector organisations to embed digital inclusion into their core work, as well as a series of different projects and programmes that we're working on with Mhor Collective and Scottish Government at the moment, which we'll get onto in a little bit. And I will say, my accent may deceive you. I am not Scottish, I am Irish, but Scotland is my home now. I'll pass over to Tara.
Hello everyone, and thank you so much for having me along today. My name's Tara French and I work within Scottish Government. I sit within the Division of Digital Health and Care, which is part of the Population Health Directorate. And I joined the Scottish Government a couple of years ago to lead on a programme specifically focusing on digital inclusion within mental health and housing. And we're now looking at how that programme can benefit more widely across health and social care in Scotland as well. But before I joined Scottish Government, I worked a lot in the digital health and care space, mainly looking at co-design and research with people to design health and care services and exploring the role of technology. But a pleasure to join you this morning. And I'm based in very far north in Scotland, not as far as Irene and Shona, but in the northeast. But I'll hand back to you, Matt. Thank you very much.
Well, no, thank you, Tara and Shona and Irene and Aaron. We're really, really grateful for you to be here. I do have to admit, though, I only just learned that Aaron isn't Scottish, and I did bill this as an all-Scottish panel, so should we keep him or should we ask him to go? I don't want to make the call by myself. Feels like false advertising. All right.
He's a keeper. He's a
keeper.
One.
It is true.
Yeah,
okay.
we accept him as one of our own.
All right. Acceptable. So let's go. We're going to start with you, Aaron. Why don't you begin by telling us, we want some perspective on digital inclusion in Scotland. Can you tell us a bit more about the state of digital in Scotland, maybe what it was like before the pandemic? We know that was a big catalyst around the world for going digital. So maybe what was it like before that and what it's been like since?
Absolutely. So I came to this work in the summer of 2019. So I had a few months in the job before things really took off. But kind of previous to that, and I did a bit of background checking before I joined the panel today, and we actually had our first strategy that mentioned digital inclusion in Scotland from the government in 2011. So we have some history there where it has been on the national agenda and it has been recognised as something that's really important. And back then we referred to it as digital participation. And that was followed by a digital participation action plan in 2014. And that really set out a kind of the framework of it's the requirement of skills, having access to devices and the confidence to be able to be online. Alongside that action plan, we had a digital participation charter. And it was a vehicle really for leveraging support across all the sectors in Scotland. So our voluntary sector, our public sector and our private sector. And they had 5 pledges. And the ask was that any organisation in any sector operating in Scotland signs this charter and signs up to these 5 pledges. And the focus was really on digital upskilling and doing your bit for Scotland to help build digital skills and capacity across the different sectors. And around that time as well, we had some commitment from the government to support an annual fund, which was the Digital Participation Charter Fund. And that was a fund that gave small grants of up to £10,000 to kind of quite often grassroots and community-based organisations to help build their capacity for 12 months to start to embed digital inclusion and digital upskilling in the work that they do. And that kind of formed really the crux of what we were doing up until that point. Back then, when I first joined, it was that thing of every conference or event we went to, you'd go into a room and start talking about digital inclusion, and maybe about 20% of the room would get it. And they'd be like, okay, I can see where this might be relevant, but very much still felt like a luxury, and that, it was something that would be nice to have, but didn't feel that important to people. Fast forward then to March 2020, we all know what happened then. And things really took off for us, and it fundamentally changed how we were delivering, what we were doing, and really forced us out of just looking at digital skills, but looking at digital inclusion more holistically. And we were really lucky at that time because we had someone very senior in Scottish Government who completely understood how important digital inclusion was going to be during the pandemic and during the lockdowns. And she put out a call to action, which we disseminated through our network. We have over 4,000 member organisations across Scotland and quite a wide reach. So we put this call to action out saying that as this lockdown comes in, people are going to be incredibly isolated. People are going to be cut off from friends, from family, from support. And those that are most vulnerable in Scotland are really going to suffer because of this, and we need to do something. So we brought together a big group of people late March 2020 from the private sector, the public sector and the voluntary sector. And we had these big, huge Zoom meetings with like 50 people on it, and we were all trying to work out what will this look like? How do we design a response to what's coming down the line with the lockdown, and what do we do about it? And Irene and Shona were part of that as well, and they'll remember, I'm sure very fondly, a lot of the meetings that we had, and a lot of the panic, because at that time it felt like a real panic of, this is so pressing and so imminent, and right now people are already in lockdown and they're cut off if they're digitally excluded. We need to move fast and we need to get something done really quickly. So we did a test and learn process. We did some initial pilots. It wasn't pretty, didn't always work very well. We had a lot of long days, but we managed to pull something together. And by early May, it was announced our First Minister would have a daily briefing during the lockdown where she would update. At the time, it was Nicola Sturgeon. She would do an update on kind of, recent stats around COVID and what was happening. And it was early May that she announced that the programme, which is now known as Connect in Scotland, would be going live in a few weeks' time. And what really struck me, kind of in retrospect, looking back at that, was how quickly we were able to spin up such a large programme. So it was exactly 100 days from the very first meeting where we all came together as a collective thinking about what are we going to do, to the day it was announced during the First Minister's daily briefing. And we think about, we're lucky in our sector, in the voluntary sector, we can be quite agile, we can move quite quickly. We know that our colleagues in the public sector don't always have that luxury. But to work across the three sectors collaboratively with so many people involved and to go at such a pace and get something really designed up and developed and ready for delivery in 100 days was really astonishing. And I think that reflected the kind of spirit of that time and the want of people to do something and play their part. So we did that, and the programme launched. We continued to get more investment from the government over the next 12 to 18 months. And ultimately it ended up, I think the investment was around about £50 million was invested in it over the course of that programme, and it reached over 60,000 households. And that was providing devices, unlimited data connectivity, and the skills and confidence support, which was provided by our lovely colleagues at Mhor Collective, who were leading on the delivery of the training. And I think you guys have delivered training to maybe over 4,500 people off the back of that programme now. Yes, because I looked at the stats the other day. So tremendous reach, and it was, something, but it was, and it's very important to highlight, it was a pandemic response. It was a very specific piece of work. And subsequent to that, it's been under a review process. So our government, in its 2021 programme for governments, the newly elected government, which was the previous government who won the election again, committed in their programme for government for this parliamentary term £200 million investment to continue that programme to reach up to 300,000 households, which would have been a significant investment. Because we knew it was a pandemic response and because it wasn't necessarily a sustainable model, but it was necessary at the time, there was a lot of work done to develop a new business case on how the programme would be delivered. And a lot of that was looking at one-to-many models rather than one-to-one, so device lending libraries and such. Since then, progress has slowed down slightly, and I think we're starting to feel the effects of a lot of the resource that was committed by government during the COVID years, and quite big holes in our budgets in Scotland, as I'm sure is the case in many countries across the world following the pandemic. So that commitment to the 200 million hasn't been realised, and the investment since then has been somewhere around, I think it was 15 million was in the business case, and the actual investment over the last 2 years from the government has been about 1.5 million. So a real kind of slowdown and a bit of a come down from that initial promise in the programme for government as to what the programme would become, and the realisation of the financial constraints of what actually could be delivered. And that brings us up to now. So I'll leave it at that, because I'll kind of wrap up at the end, Matt, with some final thoughts on where that is now.
Well, thank you very much for that context, Aaron. Aaron and I met, it would have been late 2020, early 2021. GEO Nova Scotia was seeing the same challenges that you were in Scotland. We didn't have the multi-sector networks already in place. But when we started our own work and began to connect people with internet and devices, and we knew we didn't have the skills piece figured out, one of our consultant partners did some research and discovered you and discovered the Connecting Scotland program that you just described. And it was pretty awesome because as soon as we connected with you, we heard about a program that was just far more sophisticated, far better resourced, far bigger than what we were dreaming of. But it was very similar otherwise. It was quite inspiring and validating. And then, of course, you know, the skills piece was the biggest challenge that we hadn't addressed yet. And that's when we met Shona and Irene, and they've been working with us now for the past few years to bring that one-to-one skills-based training over here to Nova Scotia. Let's go to Shona and Irene. What else would you like to add about digital inclusion in Scotland, where it's been, where it is now?
I think for me, what sort of has continued to happen though since the pandemic is that massive commitment to online services. So while there might have been a little bit of a pullback financially in terms of investment in digital inequality and challenging that inequality, there hasn't been a slowdown in the speed at which public services that are essential to people's health, well-being, financial resilience, all of that, those things continue to gather speed. So we're increasingly a digital landscape and a digital society for people. So we're not seeing that sort of slowdown. So the need continues to be there. And I think as well as we've kind of moved forward, we're seeing more of the sort of interlinking inequalities and how digital inequality contributes to poorer outcomes, poorer educational attainment, all of that. So it's about how we continue to move forward with that as well. But I don't know, Shona, what else do you think?
Yeah, I think between you and Aaron, it's been summed up really nicely. And hearing Aaron talk about Connecting Scotland at the start, it made me go, oh, God, that was quite amazing, actually, because it was a disaster at the time. But hearing it all and thinking back, what we achieved was remarkable. But I think COVID did a lot of things. Two things it did was obviously accelerate the response and how people got online, and a lot more people recognised how important that was to include people and get them access that they needed. But it also, like Irene's just touched on, it made public services accelerate their services online. So now pre-pandemic, we didn't always have an issue with getting people devices. That wasn't really problematic. People maybe had access to a device somewhere or a family member, but more and more that basic device access, or certainly having the appropriate device access, is becoming a bigger problem now. So people may have a smartphone, but if you're carrying out health applications and health appointments, smartphones maybe not quite the right device anymore. So you may need a smartphone and a laptop, or a smartphone and a Chromebook. So the demand on device has definitely become more problematic, and making sure people have the right device to access the right services, and then the skills on top of that mix of devices as well. So although for some people it's accelerated and it's pushed them online, for the ones that are left behind, they're even further behind than we ever thought they would be because of that acceleration. So we've got a bigger skills gap and a big device and access gap as well, I think, is part of the landscape that evolved from COVID.
I guess we're also continuing to see, in terms of what are the challenges that we're seeing now, we're also seeing the challenges facing frontline staff. So as services become digital, increasingly digital, frontline staff from across sectors, public, private, third and non-profit sectors, are really struggling to support people in engaging with these online services themselves, because quite often they're sort of overstretched, or more commonly don't feel they have the confidence and skills themselves to introduce a new digital tool or a new digital service to the people they're walking alongside. So that's definitely something that we sort of really work to, is how to give those frontline staff the skills and confidence to do that, and also to how to help organisations think strategically about how necessary that is. That if they're going to introduce a digital system or a digital platform, that they are thinking, well, how is this going to land with people with the lowest levels of digital skills? Because we know that those frontline staff can really change the picture for people. So I think that as well, that's what we're seeing.
Both. It's something certainly we've seen here in Nova Scotia as well. And the more we engage in the world of digital inclusion, the more we discover the different nuances about how connectivity or devices or skills is necessary for different people in different situations with differing abilities and different needs. And probably on the skills piece, it's the most complex because each of us is different. What we want to learn is different. How we want to learn it is different. And speaking of learning, we've certainly learned, as I mentioned, a lot from the two of you about how to help people with digital skills, and we'll be talking more about that in just a little bit. But first, I want to get us over to Tara, because here in Nova Scotia, health has been our obsession for a number of years, and healthcare, and now in the last few years, digital health services, mental health services. We have a new app now, the Nova Scotia Health app, which is a portal to access information and test results and book appointments. And we really feel like we're finally on a track to kind of bring healthcare and digital together. Tara, you're in that space in Scotland. Scotland arguably is a number of years ahead of us on that. What's your experience? What are some things that you're working on? What's happening over there around health that would interest us?
Yep, so there's a whole range of different innovations happening across the digital health and care landscape here. Obviously, some of the work before the pandemic, a lot of innovation in terms of digital access, with work such as Near Me, which is looking at video consultations and supporting people to access appointments digitally. NHS Inform, which is our national website where people can access online health information and related to different health conditions. But we also have specific programs, just to give a couple of examples, looking at mental health. So we have a digital mental health program which has seen a huge increase in the options for people to engage in digital mental health therapies, in online self-management, and also we have work in the digital social care space as well. Again, looking at Near Me within the social care context, but also some really exciting work looking at a future workforce role called a care technologist. So really thinking about how that role can support people who are accessing social care support to think about what types of technologies could benefit them in their home with their care, which is really exciting because it links so much to how we're supporting people to be included and to have that access and confidence and skill to access some of these digital services and technologies that are available. And then just to mention a few specific digital inclusion programs that we've worked on. We had, during the pandemic, the Connecting Scotland's Care Home Residents, so thinking about how to support residents and staff within care homes to access technology, and of course the absolute importance of ensuring residents could connect to friends and family during that time. Through that work, we also jointly fund with Drugs Policy a programme called Digital Lifelines, which Irene and Shona are also involved in, which supports people who are at risk of harm from using drugs. So it's specifically looking at the digital inclusion needs within that context. And then more recently, the work that I'm involved in is the digital inclusion in mental health and housing programme, where given the growth in digital opportunities in the mental health space, again, it's about how are we ensuring people can access those services and therapies. And equally, in housing in Scotland, the digital inclusion agenda is much further ahead with the work that Housing colleagues and organisations have been taken forward over a number of years. So it's a real opportunity to learn from some of the models and the ways that support has been provided in that context, and think about how that links across wider health and social care as well. And I think what's really, really important, and what always sticks with me, as I say, prior to joining Scottish Government, I think the key thing that we have in our strategy around digital choice, and how we enable that. And I think it's the digital choice in terms of people who wish to engage in services through that digital method. How are we in supporting so that people can have that choice to do that? And equally, how are we ensuring that that choice is offered where there are digital options to engage in health and care services across Scotland as well? But that's kind of the thread through our strategy, as well as how are we enabling that digital choice.
Awesome. So much going on, and you mentioned housing, which is probably our next and newest big obsession as the housing crisis continues to sweep across the province and, in fact, the country. I'd like to go back just a minute, for a minute, if we can, for you to tell us a bit more about Near Me. I remember learning about this, and it was quite striking, about this platform that's dedicated for these video conferencing. And the first example I read about in Scotland sounded like it was ripped right from Nova Scotia. You've got somebody who needs to have a specialist appointment. They're 4 hours away from the city where that specialist works, and it's a multi-day trip just to get 30 or 45 minutes in front of a specialist. And you've developed, Scotland's developed this this custom platform to tackle those sorts of things. What can you tell us about?
Yep. So I think it's also quite fascinating how, I think, reflecting on what Aaron was saying, the interest in digital inclusion pre-pandemic, and then the kind of growth and interest through the pandemic and now, and because the opportunity to use video consultation has existed for a number of years now, but during the pandemic, the growth in the number of Near Me calls that were happening was just, huge. And we're now at a point in the programme has actually now moved into a more, it's moved from a programme into business as usual, and is available across Scotland. Predominantly, it's used within primary care, but there are also within the mental health programme looking at that video-enabled therapy using Near Me. But again, it's alongside that work. It's what for people who are not able to, don't have their own device at home, or don't have that connectivity, or don't have the confidence perhaps to engage in a Near Me call. What are we also able to provide within the community? So the programme had also explored the role of libraries, Near Me in libraries, providing that connection for people to be able to access. Because as you say, the geography of Scotland and just how far it can be for people to have to travel to those more specialist appointments is, significant, not just in the time and the cost, but, the emotional point of, traveling as well for people, and the demands it places on people. And we've also been exploring setting up a community hubs network as well. So in Scotland, that are, I think we now have about 60 community hubs in different locations, again, who are supporting people, the workforce in those community hubs. It's just amazing how they're providing that support to people to be able to access Near Me and video consultations as well. And I know Irene and Shona have also been connected into that work, because that's such a large part of this as well. It's thinking about how are we also supporting the workforce alongside, people accessing services to make sure that they are confident in being able to support people to access things like Near Me and other services that are on offer, but also making sure they are offering that choice to people where Near Me is available, for example, as well.
And I was just going to comment there as well, Tara, around that sort of idea that you touched on about choice and why people might use services or not. And that's been a really sort of important bit where all of our work sort of interlinks, is trying to understand. So part of a big bit of work that Mhor Collective does is we do a lot of meeting people where they're at to try and understand what the wider challenges are of their lives. If you're somebody who's experiencing homelessness, your setting is very, very different to, for instance, an older adult in safe and secure accommodation who also has limited digital skills, but for very, very different reasons. So while we're sort of looking at these programs, we're also trying to make sure that we're doing grassroots work or co-design work with people with living experience of different and intersecting inequalities, so that we can understand why you're not using it and what are the reasons behind that, and then exploring how to enable choice to make sure that they feel comfortable and confident as well if they should choose to use it. So I think it's also about what we are doing to sort of understand what that really looks like. So in terms of health, for instance, one of the projects that we've worked on for a number of years, Tara sort of touched on it, is Digital Lifelines, which is working with people currently using drugs to understand both how digital services can support them in making safe and informed choices about their drug use, keeping them safe and well, but also understanding perhaps the systems that have been done to them in the past that have maybe negatively impacted them or frightened them or sort of driven them away from that digital service delivery. And we've done a lot of work around there, sort of working directly with people in those circumstances to understand that, so that we can then feed that into what choice really means and how do we empower people at point of need, I think, a little bit. We've also done some work as well. Shona, you maybe want to speak a little bit about discovery and the work that we're doing at Discovery College, which is a space for peer support for people experiencing challenges with their mental health.
Yeah, Discovery College is a relatively new project for Mhor Collective. It came from the back of a Canadian model, I believe. Discovery Colleges were originated in Canada, and mental health and wellbeing part of an organisation in Scotland called Centred set up Discovery College, and that is all about supporting mental health, supporting wellbeing, doing a lot of online learning, delivering that where people need it and where they're at. And within that service, we have now embedded one of our own colleagues, Anya, within Discovery College. So she's in that. Discovery College has a physical space and a very large online presence across the Highland community. And Anya is now embedded in that space. And as part of the project, she has devices to give out to people when they need it, along with 12 months worth of data, so that they can get access to that device and data for supporting their mental health and wellbeing. The overarching aim of the project is to support NHS, so support our health service. They can make referrals into our colleague Anya and into Discovery College. That's what we want to learn. And as part of that, we want to learn what those barriers are, what prevents the NHS and the third sector partner working collaboratively, because that sometimes doesn't work as well as it could. And usually it's through time restraints and staff not having enough resource and all those things. So we're learning lots about that partnership, which is brilliant. But having our colleague Anya specifically looking at digital inclusion, sitting within Discovery College and supporting not only the people coming in to use that service, but all of the peer support team as well. So she's helped boost their digital skills, and she's there on hand to do digital drop-ins and support. And the next phase of that is actually Anya's going to do some outreach work. So she will be based within facilities, within NHS facilities where people are, to support them with digital. So we are learning lots. We're only 5 months into that project, I think, but we have learned so much already about working directly alongside both third sector health partners and our public NHS health partners and what the challenges are, what we're learning and what we can do better to support them. So we've learned lots through that, and overarching sort of feedback is it is having that one person physically there, only looking at digital inclusion, having that focus has been really, really helpful. That's what we've learned so far.
And then within Sahelia, so Sahelia is a charity that we are working with as well, which is a specialist mental health organisation for Black, minority and ethnic and asylum seeking women and girls in Edinburgh and Glasgow. And we are sort of supporting that organisation, looking at how digital women from a range of different cultural backgrounds, but what we're learning in our work, working alongside those women, so the frontline staff are sharing their experiences of both digital and social inequality and what that looks like and what their needs are as frontline staff, so that they can then also support the women. They are walking alongside the people accessing the services, the women accessing the services. And again, it's about going into those spaces and kind of listening to those with that living expertise to go, okay, this has to look different. In this context, this looks different than it might do. So there isn't this sort of unique one size fits all. Although what we can do is we can really listen to those with living experience and then explore how we scale it. And that's why these kind of things all sort of feed into each other. But there isn't always this sort of perfect uniform model. Even within Connect in Scotland, we were asking organisations to tailor what they were doing to meet the needs of those they're serving, supporting or working alongside, and really be thinking about that. But to do that, we have to understand the needs of everybody within those spaces.
Yeah, absolutely. And, you know, one of the big themes that we're hearing today and that we've heard from Scotland all along is it's not just what you're doing, right, making sure people have devices or internet or skills, but it's how you're going about it, how those programs and systems are being developed and refined is a piece of work unto itself that really deserves a lot of credit and deserves a lot of attention because, you know, I think most of us know what it's like to experience a program or a system being developed by people who aren't really involved with it, who aren't delivering it or who aren't the recipients of it. And that disconnect often means when it lands in the real world, it works for a very limited number of people. And I think what's brilliant about digital inclusion as a relatively modern social imperative, unlike some of the others, is that there's still a lot of work that needs to be done. There's a lot of systems that haven't been built yet. And I really hope that Nova Scotia will continue to do what we're doing and following Scotland's lead by engaging with all those partners in different sectors. It's kind of cool because just like you know, we work across different sectors. It's not all in government. It's not all in the community sector. It's not all in business. There's a piece in all three. But you're also describing how you're going up and down within organizations and sectors where the people who are right at the front line delivering programs are getting a voice to the people who are further away and making some decisions. And that seems really, really an important takeaway. The other thing I just wanted to reflect on was that idea of going to a library and getting support. So the near me, you know, if you can log in at home and you've got the technology and you've got the skills and you can visit your doctor, that's great. But for many people, they might not have one or two or three of those things, the skills, the devices, the connectivity. But to be able to go to your library and have a confidential, you know, experience is one that really interests us as well. Because, you know, even if you have a computer at home and the connectivity and the skills, there's some appointments, there's some meetings. I think of people seeking counseling, people experiencing gender-based violence, all kinds of things where your home may not be a quiet or safe space to have that meeting either. And so ensuring that there are private spaces in public places where support is there so people can really engage feels like a big opportunity for us. All right, let's talk about plans. Erin, you've been on a journey. Scotland's been on a journey for quite a while. You mentioned some work in 2011 and 2014, and more recently, SCVO published a roadmap called Making Digital Inclusion Everyone's Responsibility. What can you tell us about that?
Yeah, so we I think partly recognized that with the momentum feeling that it had slowed off the back of Connecting Scotland and all the work that happened during the pandemic. Maybe almost a sense of frustration that we felt maybe as a nation we didn't really know where we were going next or what should happen next and how to articulate that and how to plan forward. So we wrote and published what we're calling our roadmap, and it was kind of us setting out from SCVO our point of view and our aspirations for the future of digital inclusion work in Scotland. And within that roadmap, and it's very much, Matt, you've already talked about learning from Scotland, but that's a two-way street. We've learned so much from you and from GEO Nova Scotia and the work that you're doing as well. And one of the things that's always really struck me is how you talk about the stone soup analogy, which I'm sure a lot of people joining the conference today, if they've heard you talk before, will have heard your stone soup. And it's the same for us in kind of taking that idea and kind of thinking about digital inclusion is everyone's responsibility because we all benefit from it, whether that's in our sector, in the voluntary sector. We can use the funding that we get more efficiently by delivering services more efficiently through digital means. The public sector certainly has efficiencies they can make in terms of how they deliver services. Private sector will benefit from increased customer base, wider reach. All the sectors benefit, but not necessarily everyone's doing their part. So how do we get to a point where we can actually articulate that and demonstrate why everyone should be doing their part? And that's not to say that our call to action is that everyone must do everything, but playing to your strengths. Where can you add value and where can you as a sector or an organisation in a specific sector do something that plays your part? So within the roadmap, we kind of set out the 5 challenges, as we call them, and it's mirrored in another piece of work that we did with Tara and the government, which we've got our 5 pillars, and that's kind of, they're essentially the same model, but it's contextualized in a health and care context in the digital pillars paper that we did with Tara. But our 5 challenges are kind of telling the story of what an individual, for the most part, needs to get to a point of inclusion. So having the motivation in the first instance to actually want to get online and not have any kind of barriers to that in terms of fear and kind of the unknown, having the appropriate device, having connectivity, having skills and confidence, and then finally the internet being somewhere that actually once you get there you're able to access easily and able to understand different digital services and platforms, and that we're actually designing digital spaces in a way that takes account of a lot of the stuff Irene was just talking about user needs and kind of co-designing things so that digital spaces are accessible. So we're kind of our roadmap sets that out, and I think for me my 2 key takeaways from the roadmap. The first is that we see some of our peers, some of our contemporaries will talk about wanting to eradicate digital exclusion. We've always, and in Scotland, we've always kind of understood digital exclusion as being a form of social exclusion and being inextricably linked to poverty. So without eradicating poverty, we can't eradicate digital exclusion because poverty is the driver of digital exclusion. And it's not within our gift in digital inclusion organisations to eradicate poverty. Certainly it plays its part and can contribute to that overall agenda. But also thinking about how digital exclusion is a cycle and it's not a destination that you reach because circumstances change over time. And I may be in a point of inclusion right now myself because I have adequate digital skills, enough to get by. I've got my devices, I've got my connectivity, which I'm fortunate to be able to afford. And I can do everything I need to do, but I could lose my job next month. My health could deteriorate and I could end up off sick. I might not be able to afford those things anymore and find myself in a point of exclusion. And these things are things that will challenge us, everyone will face. So thinking about it's not a destination, it's just something we need to be able to respond to. So the roadmap really looks at how do we build an infrastructure to support people when they need it and can respond to different needs at different points in people's lives, rather than seeing it as something, a problem that's going to be solved and that's it done, and then we move on to the next social issue. So that was kind of a roadmap that we're really proud of and starting to do the work now to build up activity around that.
Well, fantastic. And I'm just going to take a moment to say to everyone who's watching this stream, you've heard a lot of different kind of documents or resources or reports that have been referenced, and we're going to do our best to post those online after the fact as well. So if you haven't been able to jot stuff down fast enough, don't worry. we've got your back. So Aaron, the roadmap was a little while ago. What's happened since? You want to talk a little bit about the audit?
Yeah, so very recently, so August of this year, there was a report published, and the report comes from a statutory body in Scotland called Audit Scotland. Audit Scotland's an independent body, and it's essentially tasked with doing audits of finance and also performance of different public sector bodies across Scotland. So over the last 18 months, they had been doing an audit of both Scottish government and local government's performance and the wider public sector's performance against digital exclusion. And that involves going out and speaking to people, speaking to communities. They commissioned some lived experience interactions. They spoke to different organisations and they looked at kind of all the different policies and strategies and commitments and took all that into account in doing this audit to see how well is our public sector in Scotland performing to tackle digital exclusion. And the outcome wasn't terribly positive. I think the key takeaways were that momentum has been lost since COVID, since Connecting Scotland. The promise of the financial commitments have been kind of rolled back significantly from that initial £200 million commitment to something closer to 2024, I think it was 1.5 million. And that's just kind of bringing that up in terms of context of the scale of kind of the promise from 2021 to the reality of 2024. And also kind of nationally, a lack of leadership around driving the agenda forward, which is really important, as we all know, that leadership and pushing that forward. But what was quite reassuring to see was they did reference our roadmap document quite a lot throughout the report, as this is a framework that could be taken forward and used to help drive this work forward. And while a lot of that does sound doom and gloom, there were some good practice examples in the audit as well. So a lot of the stuff that Tara's working on and the stuff from digital health and care came out as, here's some really great examples of work that is happening that should be built on, and we should see more of this across different government policy areas, not just digital health and care. So it was nice. It was nice to see that the roadmap was picked up by Audit Scotland and that they thought actually in the absence of national leadership, here is something actually that should be adapted by the government and taken forward.
Very interesting, and no doubt, leadership at the highest levels is really important to drive, especially these sorts of emerging changes. Something we're really grateful to have here in Nova Scotia, but something that can't be minimized as a matter of importance. So thanks for that, Aaron. Really interesting to hear, and no doubt that the road is never a straight line. But I think it's clear, whether it's Scotland, Nova Scotia, or anyone else, the jurisdictions who figure this out first, who put the resources necessary and the people required to get their whole communities connected, are going to have a big advantage over the next many years, whether, as you said, in the public sector, the community sector, the private sector, individual lives all gain efficiencies and opportunities that just simply wouldn't otherwise exist if it wasn't for us all coming together to make this happen. So affordability, obviously a big challenge. It's an ongoing piece, right? Devices don't last forever, monthly cost to bills, and there is a cost of living challenge happening here and there as well. But as we've said, those two pieces can be pricey, but they're not that complicated, right? It's just about getting devices and connectivity to people who need them. The third leg of that digital inclusion stool is skills, and this is the one that we've certainly experienced the most complexity, going back to that idea that every one of us learns in a different way from different people, and we want to know different things. And this is where Shona and Irene are our gurus and specialists. And I'd like to hear a little bit more about the work that Mhor Collective does, and a little bit more about that principle of why one-to-one support and how you've tapped into existing relationships, how that leveraging those, how that's bringing digital skills to people in Scotland.
I think like digital inclusion, Mhor Collective has evolved over the years, and even prior to setting up Mhor Collective, we used to very much go out and do that one-to-one support. So we would go into the libraries, we go into different community settings, and we would work with that learner. And as digital inclusion has evolved and the problems increased, we've definitely scaled that up. So we work much more at organisational level now, rather than going out and helping one-to-one all the time, because that's not that sustainable for us. We're a small team. So we work much more at organisational level to support that staff, those community workers, the health workers, whoever that trusted intermediary is. They're the key component in helping that end learner, that end new learner. They're the trusted person, helping them feel confident, helping them understand that digital inclusion is a problem, because that can quite often be a barrier in itself, where people think it's a problem that's going to outgrow itself because young people will just learn. And we know that, and research shows that young people don't have the full set of digital skills to keep themselves safe and do everything they need to do online. So the problem isn't just an older generational problem. It exists and keeps existing for a multitude of different reasons. So we've evolved as an organisation to try and support a wider network, I guess, and work at that organisational level instead of trying to work one-to-one all the time, but always trying to do it as an embedded approach and learning, as Irene had touched on previously, learning what the needs of those individual communities are, whether that is asylum seekers, young people with care experience, older adults, people at risk of homelessness. We would always work with the expert within that field to learn what the barriers are for both the support worker and the person that they're standing alongside and supporting. What do we need to do to help both sides of that and make it better for them? Yeah, Irene, I don't know if you want to come in and talk about specific projects or...
I was going to give the example really of somebody experiencing homelessness and why the relational approach is key. So why that person is less likely, for instance, to go to a library as a source. So if you're somebody that's experiencing homelessness, your life, every aspect of your life is really, really complicated, and all the potential paths out of homelessness, whether it's education, secure accommodation, employment, better health, so all the things that might help you recover from homelessness, all in Scotland at least have a digital element. You can't find a home without being able to access the housing register. You can't get better healthcare without a certain level of digital literacy. Even our prescriptions are online in Scotland now. So all of these pathways are closed off, and quite often people present in these services going, I need help. Now, they don't come and say, I need help with digital. They come and say, I've got nowhere to sleep tonight. Can you help me? And that's why the person who meets them at point of need, whatever that need is so key, because they've come saying, please help me. So that's the opportunity where instead of that person going, I'll find your house, and doing that to them, and contributing almost to disempowering that individual, that person can instead share their screen with them and go, let's work this out together. Let's find where there might be a temporary accommodation for you tonight, but also what else is going on? Where else can I help you? So that holistic care and that relational approach is absolutely integral, because people who are facing multiple complex challenges don't go to a classroom environment or even a sort of dedicated space that they might previously have felt very alienated from for lots of different reasons. So we sort of increasingly see the importance of seeing things through a trauma-informed lens. So really understanding what it might be like to have experienced trauma or hardship or these things in your life, and how that might contribute to how you sort of learn. And another thing that we see as well is how digital inequality also shows up in the workplace as well. So we're really lucky in Scotland that, for instance, within the voluntary sector and the non-profit sector, organisations are increasingly recruiting people with lived experience. So the chances are higher, for instance, within homelessness, that staff working in homelessness will have that experience themselves sitting behind them. They're now an employee in a workforce, and hopefully they have secure accommodation. But previously they had experienced homelessness. So they're bringing also that experience of inequality, digital, financial, all those inequalities come with them into work. So a key piece of developing the digital skills of people currently experiencing homelessness is also developing the digital skills of the staff within those organisations that are meeting people's needs. So we're kind of trying to do all of that, but the relational stuff is the bit, the changes lives. And we've got examples from across our work. Sometimes when you say you're doing digital inclusion, it sounds about woolly or whatever, but we have examples from across our work in all of the projects that we're talking about today of how it can also contribute to saving lives. How, if you can support somebody who's on a recovery journey to maintain sobriety, how that can minimise the likelihood of a drug-related death, or how connecting somebody to a family or friends when they really need that again can contribute to a wider picture of saving lives. So we have all these sort of stories and evidence that we gather going through this. When we make people at point of need and contextualise our digital skills support to be meaningful to that individual at that point, then it really can really make a difference to their lives.
Yeah, I really love, the Digital Champions program that you deliver. And I just want to explain a little bit for the people at home who might not have clicked into how this works. Is when you've trained 4,500 people, those aren't individual end users. Those are staff, volunteers, people who work in service organizations, who work with many, many people, and you've trained them to be a digital champion, to be somebody who has a pre-existing relationship of trust with a vulnerable person, with somebody who doesn't have what they need, and by empowering them, by giving them resources and skills to be more confident to help the person that they're sitting alongside, you're creating this kind of secondary workforce, hundreds, thousands of people across the province who are then doing what they do best and also helping somebody with digital skills in the moment as it's needed. And it's really brilliant. The other thing you mentioned is how, digital inclusion may find its way to somebody for one reason, but it impacts their whole life. And it would be impossible to calculate the benefits and the ripple effects of this. You mentioned connectivity to family and friends. We saw people, seeking mental health programming online because it wasn't in person during the pandemic, and that was cool. Then we saw people accessing services online. They could have gone down the street, but they're not going to do it. But online was a safer place for them to show up to a program and receive support. But ultimately, the biggest impact we've seen on mental wellness is the connectivity to family and friends. People living in isolation, people with family away, and what a difference it makes to them and their mental state to be connected like that. It's really exciting. We call it the super social determinant of health for a reason, because connectivity is the pathway to finding most of those other key social determinants of health. Okay, I see we're getting, I can't believe we're already running out of time. We have some questions from the audience coming in. I want to get at least to one or two of them. But before we do that, I've got a door prize to announce. So our very first door prize of the day, a $250 gift card to Orchard, Canada's largest refurbisher of mobile devices, is going to Cara Bain. Cara is with the Cape Breton Community Housing Association, a wonderful organization. Congratulations, Cara. Thank you for tuning in. And now, before we get some questions, I want to give each of you one more chance to tell us what you think we need to know. What advice would you give us in Nova Scotia, based on your experience and perspective, for us in our digital inclusion journey? And let's start with Tara.
So I think it's, if you're dependent on what you're working on, but certainly as someone who has come into this work, it has absolutely been about that collaboration and partnership. So when you think about the way that we've been framing digital inclusion is around that collective responsibility. But I think related to that, it's how you can work with people who have that digital inclusion expertise in terms of helping understand how to bake it in to the work that you're doing. If you're someone who's working in health and social care, if you're within a policy context, whatever you're working on, what is that relationship to digital inclusion, and how can you take that step to think about how can it be embedded in your work, but who is it that you know, who are the organisations, who are the partners that you can then work with to really understand how to do it well and how to tailor it for the people you're supporting or the context you're working in. So yeah, I think for me it's that partnership, collaboration, and just at any opportunity you can bake it into your work.
Love it. Love it. Thank you, Tara. Aaron, how about you? What advice would you give us?
I think my advice would be around momentum. And I know we're both at different stages on our journey, and we both, Scotland and Nova Scotia, had started at different times, but I can see the momentum growing in Nova Scotia, whereas ours feels like it's maybe waning a bit. So don't let go and don't lose that momentum. In 2020, we couldn't have predicted what was coming down the line when we were faced with the pandemic, and we did everything we could then. Now we have the benefit of foresight. We're not necessarily looking at another pandemic coming, but the digitisation and continued digitisation of our lives and of essential services are going to have the same effect. And we now have the benefit of foresight and hindsight to be able to respond to that a lot more effectively. And I think that's how we'll be judged going forward, is have we learned our lessons from the COVID years? Have we embedded them? And have we created more equity for people? So yeah, keep your momentum. Please don't lose it.
All right, we'll do it just for you, Aaron. All right, let's hear from Shona. What would you like to share with us, Shona?
For me, it's definitely don't assume that digital inclusion is someone else's problem. It is your problem. It is everybody's responsibility, and you can do something to help. So don't just think it's going to be fixed somewhere else, because that's definitely a mistake that's been made across Scotland and still being made, that someone else will fix this problem. And it's not. It's everyone's problem. It's everyone's responsibility. And if everyone did their tiny bit, it would help the much bigger picture. So do not assume it is someone else's problem or that someone else will fix it, because that's not happening. That would be my piece of advice. Take the responsibility and do your small bit.
Very good advice. Thank you. Last word over to you, Irene. And I think we'll have time for one of these questions after this.
I'm happy to finish on Shona's last words there.
All right. Thank you. So here we've got a few questions. I've got them over on my device here, and there's a couple that are similar that I think we'll field as best we can. What is Scotland doing to ensure people have access to internet, including those with low income and seniors? Someone else asked, does the government provide simple, easy-to-use devices for seniors and those with physical challenges? Have you had any experience or perspective on technology for people with maybe limited ability?
One of the organisations that we work with in Scotland is called AbilityNet, and they specialise in working with older people and people with disabilities, and they recommend a range of different devices or adaptations you can make to kind of out of the box kind of high street devices. So they're kind of our go-to for those adaptations. When we first started developing Connecting Scotland, we had some organisations that work with disabled people as part of the group to help kind of take that on board from kind of the design part of what devices are going to work best, and which is why we ended up including iPads at their recommendation as being one of the more accessible devices in terms of different functionalities and features that was designed in. But also in terms of connectivity, we have a slightly strange relationship with that in terms of Scotland has devolved powers from Westminster, the UK government. Internet telecommunications is a power that's reserved for Westminster. So a lot of telecommunications stuff happens through national UK government rather than as a devolved Scottish government. But there are initiatives to install super fast broadband cables to your more remote and rural communities, especially in the Highlands and Islands, through a programme called R100, which stands for Reaching 100.
Excellent. What a great answer to a really good question. Thank you very much. Okay. That is, unfortunately, all the time we have for our friends in Scotland today. I'd like to thank each of our panelists one more time for helping us kick off GEO Forum 2024. Dr. Tara French, Aaron Slater, Shona Munro and Dr. Irene Mackintosh. Grev Moagat. Thank you very much for your time here today, and thank you everyone who's watching. We'll see you all later this afternoon.